Okay, so welcome everyone to today's digital drop-in. Very excited to see so many new faces and so many familiar ones as well. Also very excited to co-host this event with ABCT, the Association for Behavioral and Cognitive Therapies. Yeah, really excited to talk digital mental health with you all. Before we start, I want to note that we'll be recording this session so that we could share the conversation with people who aren't able to attend. That being said, we'll make every effort to remove any sensitive information that folks share, and we'll edit the video to be respectful of people's privacy. If you have any questions about this, please feel free to reach out to me directly via email, which I'll throw in the chat right now. And just to let you all know, given how many people we have today, and in the interest of time, we'll be focusing on interacting in the chat box, and I'll provide some more details on that in a little bit. So a little bit about One Mind PsyberGuide for those who might not be as familiar with us. At One Mind PsyberGuide, we aim to help people use technology to live a mentally healthier life. One of the ways we do so is by reviewing mental health apps and technologies in aspects such as research and development that has been put into creating the app, the user experience of the app, and how the app uses its data or your data. We review available technologies and apps for mental health objectively, meaning free of preference, bias, or endorsement. All of these reviews are publicly available for anyone to read. We aim to empower people to make informed decisions about the technologies that they use, and we put that information in your hands and help you choose the app that's right for you. I'm joined today by our Executive Director, Stephen Schuler, and our Program Director, Martha Neary. Dr. Schuler, do you want to introduce yourself real quick?
I already introduced myself in the chat, but I'll just say again, my name's Stephen Schuler. I'm a clinical psychologist by training and a faculty in the departments of psychological science as well as informatics at the University of California in Irvine. And also note, I'm an ABCT member, and so super excited for this partnership. I cannot remember how long I've been an ABCT member, mostly because I don't have John Grayson giving me stars for every year at conferences recently, but I've been an ABCT member for quite some time and really consider it my professional home. And so excited to see the names of many folks in the participant list that I also typically see at ABCT conferences, as well as other new names. And so really excited for this partnership and some opportunities to try to create a community and some dialogue around the areas of digital mental health to really help people bring in their experiences and other people to learn from these experiences, because in our experience we find it to be an area where people are really interested and have a lot of questions, and having some opportunity to dialogue with others in the field I think is really useful.
Awesome, thanks Stephen. And then like I said, Martha Neary is joining us as well. She's our program director. I just saw she introduced herself in the chat as well. And so in the interest of time, we'll go ahead and move forward with some about ABCT. So the Association for Behavioral and Cognitive Therapies is a multidisciplinary organization committed to the enhancement of mental health or health and well-being by advancing the scientific understanding, assessment, prevention, and treatment of human problems through global application of behavioral, cognitive, and biological evidence-based principles. So you can visit abct.org for some more information. But again, really excited to co-host this event with the association as well. And a quick about the digital drop-ins. In a nutshell, digital drop-ins are digital meetup groups where folks can get together to ask questions and learn from each other about digital mental health technologies. Drop-ins have also been a space where people can connect with each other and network for different opportunities in the field. And just an example of some past drop-ins that we've had digital tools in mental health for the AAPI community, digital tools for managing symptoms of OCD, digital tools and mental health for the BIPOC community, as well as digital tools for managing symptoms of anxiety. The meetups tend to be small groups, Q&A sessions. We've also had some focused talks before with some guest speakers that have been focused on a more specific topic, with an opportunity to learn from experts in the field and from peers as well. So for more information and a list of the upcoming events, you can visit our Eventbrite page. I have that listed at the bottom, www.psyber.guide/dropins. And so before we get started with the Q&A today, just wanted to note, and I note this before every drop-in and really before every chat about digital mental health, that there is no one-size-fits-all solution. So we might talk about technologies that we've reviewed or have found to be really helpful, but at the end of the day, it's really up to the consumer or the client to determine what their needs and preferences are. So whoever is going to be using the app, again, just keep in mind that there is no one-size-fits-all solution for folks in this space. All right, so what is digital mental health? Before we dive into the questions, I want to thank you all for submitting questions into the Google form over the past few days. This really helped us get a lay of the land for what questions to start the discussion with. Given all of the questions we received, we consolidated some to be a bit more broad in scope, and so we might not get to all of the questions submitted. That being said, we want to encourage you to use the chat box. If you have any follow-up questions, or I know that there's also a few digital mental health experts in our audience as well. If you have any thoughts or perspectives that you'd like to share, please throw those in the chat box. We love seeing the discussion. We love seeing that active chat box. All right, so I think a good place to start is maybe asking this question. What is digital mental health? So broadly defined, digital mental health is the use of technology or other digital mediums to treat or manage mental illness or promote mental wellness. So I've included a couple of examples here of more broadly online self-help platforms such as Happify, Wysa, MyStrength, some apps or technologies and platforms that provide treatment, connection, or linkage. So some listed there include Talkspace, 7Cups, and then some therapeutic tools and treatment adjuncts, or things that can kind of help to support treatment, DBT, Diary Card, and Skills Coach, Dailyo, Mood Notes, and CBT Coach as well. Stephen, was there something else that you might want to add here as well around defining digital mental health?
Yeah, I mean, I think I'll just say that, generally when we think about digital mental health, we're talking about expanding beyond forms of technology that really simply expand geographic access for providers. So not as much like teletherapy or Zoom therapy or video therapy that now everyone in the past 18 months has great experience with, but really these sort of novel uses of technology to scale and redefine evidence-based practices and cognitive behavioral practices. And I think John really sort of notes that one of the sort of ways we kind of think about these tools is often this continuum between the human component, how much it's represented from these completely self-help platforms to platforms that have some sort of aspect of connecting to a provider or a professional or a peer, but using sort of innovative uses of technology to do so, to things that kind of extend or improve the impact or efficiency of treatment, often hopefully based on evidence-based practices. And I think that there's some great examples here, including CPT Coach, which is developed by the DoD VA group that's developed a lot of these great therapy extenders that really help providers in their implementation and use of evidence-based practices in the treatment they're providing.
Sorry, took me a second there to get to the mute button, but next up we have a poll for everyone. Let me go ahead and get that started. All right, hopefully everyone can see that. poll, but it's just a fun way to get us, give us a bit of a lay of the land here. Have you used a mental health app before? And feel free to throw in any thoughts you want to add to this in the chat. I see Gary has a question here. What is the difference between online self-help platforms and therapeutic tools and therapeutic adjuncts? And then also, are they interchangeable in practice?
Yeah, I'll say that's a great question, Gary. I think that we often see that these online self-help tools or platforms can be used as therapy adjuncts, but I typically think about the sort of role that they're playing in those cases as slightly different things. So, for example, me as a cognitive behavioral therapist, and most of my sort of work has been in the area of depression and anxiety. I might be seeing someone for the treatment of depression, but want to use a tool that helps sort of support some of the stuff that I'm doing that's like treatment consistent. So maybe I would recommend to them like if they're having trouble with insomnia, I can deal with some insomnia symptoms probably, but I'm not an expert in cognitive behavioral therapy for insomnia. So I might recommend to them like a self-help tool, something like Sleepio, that would help sort of deal with the insomnia symptoms in the context of the cognitive behavioral therapy I'm providing, really focusing on the stuff I have expertise in. Whereas these therapeutic tools or treatment adjuncts are really meant to sort of support the tools that you're doing. So for example, CPT coach or cognitive processing therapy coach is not meant to sort of teach either the therapist or the client how to do cognitive processing therapy, but is really meant to sort of enhance the practice of that. Some of the homework assignments are present in there, some different tools to sort of securely record the sessions so they can be reviewed later, which is, as I understand it, consistent with the protocol of cognitive processing therapy. And I'll note, I am not trained specifically in cognitive processing therapy. So I know the generalities, but not the specifics. But I think that's exactly the point is, a tool like a self-help tool could be used in the context of treatment to really provide that sort of additional content or that module or that to support the client. But these treatment adjuncts are not really meant to sort of be used in isolation of receiving those treatments from providers themselves. I think that there's lots of reasons why these treatment adjuncts can be useful. As I said, they can like maybe better organize the assignments or make it more likely that the client will do them, or provide some useful way to kind of check in with the clients between sessions or to get feedback on the content that they're doing, but they're not meant to be sort of standalones by themselves. And so that's really, I think that, as I mentioned, a lot of those self-help tools might be able to be useful still in the context of treatment, either maybe before, during, or after. You can also think about them as sort of opportunities to introduce concepts, or as, after client terminates therapy, to be able to continue to do some of the work that they did. But those treatment adjuncts are really meant to be sort of integrated into a therapist or a provider with expertise in the practices that they're meant to sort of to support.
Yeah, and just to piggyback off of what Stephen had shared, I think one of the examples listed there was the DBT diary card. I found that could be particularly useful, especially with clients when working with DBT. So you could sort of replace that paper diary card that can often get lost or might not be as easily accessible to someone. And yeah, I think anecdotally, at least, I feel like it's been really helpful implementing some of that into DBT treatment as well. So I'm going to show the poll here. It looks like most folks listed that they kind of have used the mental health app before. And a few folks are really excited about using it all the time. And some folks have questions as well about what is a mental health app. So yeah, happy to answer all of that question here, hopefully in this session. And really happy to hear too that some folks have had experience with using mental health apps and are here to possibly learn some more. All right, so one of the questions that came in the Google form was, how can digital mental health enhance one's current treatment? And I think we started to touch on this with Gary's question, And I see Stephen's mentioned here as well. If you have additional questions, put them in the chat. And also curious to hear who has used the mental health app as well before. But if you, I guess one of the first question we'd like to start off with is, how can digital mental health enhance one's current treatment? And maybe going beyond sort of using it as maybe some perspective from both the provider and the consumer as well. So I'm curious, Stephen, for your thoughts here as a provider, what are some ways that digital mental health can enhance current treatment in mental health?
I think one thing I've heard from some clients and therapists is it helps sometimes support the credibility or the authority of treatments. I think that we as providers and as, in cognitive behavioral therapy, specifically too, have not done a great job about being great marketers for the treatments we have. And I've definitely heard instances, again, both on from client reports as well as other providers mention that when they're trying to build the treatment rationale for a client, like it's helpful sometimes to say like, okay, well, this treatment that I'm talking to you about, there's also an app on the App Store that supports it, take CPT Coach, for example, and it's like, oh, wow, there's an app for that? Like what you're telling me must be legit and it must be, be an authority sort of treatment if there's an app that's kind of created to support it, especially among younger clients, where it might also help build some credibility to kind of reach them in a medium that's interesting to them, rather than handing them a worksheet, you're handing them an app that's going to support it. So I do think there's, some aspect in which digital mental health can support the credibility and the authority of these treatments, especially for certain audiences. And again, I've heard this from different clients as well as providers who are using these tools sometimes. I don't know, what do you think, John? And you've done different treatments and different treatment modalities as well. Like, what are some of the ways that you've thought that digital mental health can enhance some of the different treatments you're working with?
Yeah, I really found, especially when it comes to digitizing certain tools that we've already used in therapy practice, such as, like I mentioned earlier, like the DBT cards, mood tracking in particular, or even symptom tracking has been really useful in providing things like insight to clients, at least clients I've worked with in the past. And also because the phone is already readily available, and this is something I've heard from a couple of the kids I've worked with before, because the phone's readily available, it's almost like it's easier to remind themselves of it. And so it's like sort of meeting the client where they're at too, and meeting the client with the space that they're in terms of the digital space, and really leveraging some of the tools that they've already been using as well.
Yeah, I think in line with that, it makes me think of a research study I was conducting where we were trying to build an app that was meant to sort of support therapists and clients in delivering cognitive behavioral therapy for depression. And what was cool about this research project is that in preparation for building this app, we did a lot of interviews with clients and with therapists who are either receiving CBT or providing CBT. And it was really interesting, even as someone with a sort of background and training in CBT, to actually go ask other therapists like what they were doing and what they were using, and clients like some of the barriers that they were running into. It's just something I probably should do more in therapy, but often don't get the opportunity to kind of take that external observer perspective. And I distinctly remember interviewing one client, and they were talking to me about their worksheets, and that they found the worksheets like super helpful when they did them. And then afterwards, I asked them like, well, where are those worksheets now? Do you review them? And like, oh yeah, I know exactly where those worksheets are. I put all of them after I finish it into a shoebox, and they're like, I haven't had it in a while, so they're all in that shoebox. It's like, cool, where's that shoebox? And like, oh, I have no idea. So it's like they very distinctly remembered this process of putting, collecting those worksheets and putting them in a central place, but then kind of lost that central place. And I think for a lot of people, our smartphones can be that central place where we keep our smartphones with us almost always within arm's reach. We often can kind of go back to them. They're sort of nondescript, and we can pull them out in situations sometimes that are easier to do. For example, like in certain situations, I probably wouldn't pull out a worksheet and start to fill it out, but I very much could kind of pull out my phone and type in some notes, and often do use my phone as a to-do list. So I think that there's ways that our phones can fit the fabric of our lives very well, and I think that that's an advantage when we're trying to provide treatments that we want people to be using in their day-to-day lives.
Yeah, and something that came to mind as well, Stephen, as you were talking, was sort of there's like a bit of a novelty aspect, I think, too, with some of, especially for clients who have been through a lot of therapy and sort of just approaching it from this other angle of this is something that could integrate into your technology use already. Why don't we give it a shot, or give it an experiment, as far as like maybe logging your logging your mood into this app, or logging your different symptoms that you're experiencing, so that way we could see maybe some things that can that are affecting that. And so, yeah, I feel like there's a bit of that novelty when it comes to technology there. I think there's like some exciting ones as well, like in terms of, I know personally I'm excited about using VR for teaching mindfulness. But yeah, just having that novelty aspect for folks can be beneficial as well. All right. And if folks have any follow-up questions to these, anything that we talk about, feel free to throw them in the chat as well. I think Stephen's thrown a question out to folks in the chat. How has digital mental health enhanced your practice, or in what ways do you think digital mental health can enhance treatment? And I see Julia. Training is very helpful to look at apps to get ideas of therapeutic exercises or prompts to use in practice, and also helpful to see what other clinicians are reading and citing in their research. Yeah, definitely. I think it's great to kind of have that structure, as well as, I think Stephen had mentioned this earlier, providing sort of the evidence-based, helping to provide that structure around evidence-based practices can be really useful from some of the apps.
Also just note, as John said, we've got about just over 50 people in this drop-in right now. So it's hard sometimes to have, more casual conversation with this number of people. So definitely, the structure here is John and I are having a little bit of this, facilitated conversation around some of these questions that you all entered as you RSVP'd, but would love to hear your own answers based on your own clinical and research and professional experience in the chat to these questions. So, thanks for sharing, Julia, and, for other folks, as we kind of go through these questions, it'd be great to hear some of your answers and some of the experiences you have as well, because we're really, again, in this sort of format of these drop-ins, really trying to figure out and have different ways to kind of create community and share practices and learnings around these areas.
Yeah, definitely. So if anyone has anything they want to share, again, that chat box is open. Another question that had come up in the forum was, what are recommended practices to effectively integrate solutions into care workflow? So basically, how do you integrate digital mental health into your practice? And I think this is a question that we've come across a few times now. So Stephen, I'm curious to hear your thoughts here, and sort of your expertise here as far as integrating digital mental health into your clinical work.
Yeah, I think it's a hard question, because I think that not all these tools are well thought out about how they integrate into our workflows. And I think that what's painfully obvious with some of these tools is that they haven't really thought through the clinician provider experience. I remember one specific tool that I won't name the name of the tool, but just the experience that some experience we sort of learned from using that tool is that it had a provider dashboard, but the only view for that provider dashboard was a view that displayed kind of all your clients at the same time, which was it's a really great view if you are trying to sort of manage your caseload and, between sessions, and, can be done so in a way that sort of protects patient privacy. But what was unfortunate is that there were certain ways that they expected clinicians to use this tool, like in the session with a client. And so there was no way to kind of, filter the view to be looking at one client at a time. And the only way you could kind of get to a client was navigating through kind of your caseload log. So, I think that one of the things that's just as a workflow sort of consideration for any of these tools is to sort of better understand or do a pilot of the different features that really facilitate use in clinical practice, and to sort of understand and think about, like, is this tool going to work the way that I see clients and the ways that I interact with clients, and to practice through some of those different elements that you might need to be able to do, to think through sort of issues like, if I recommend an app to a client and there's data on it that we want to review together, how are we going to do that, in the therapy room or in a Zoom session together if you're doing, therapy remotely, and to work through that, because I think that, anyone who's used technology has probably had experiences where the technology doesn't work and goes awry. And it's very, I think that you have to show yourself grace, but also you don't want to sort of lead yourself into walking into some of those technical, hangups or problems, especially if you're working with clients who maybe are less comfortable with technology, because that might highlight some of the challenges in really getting to use technology sort of effectively. So I think one of the just best practices in terms of integrating technology in your workflow is, like, know the technology and, know how it fits into the things that you typically do in sessions.
Yeah, I agree, Stephen. I think knowing technology is an important first step, especially when you're first integrating it into your care. I also think maybe understanding what some of your goals are with the technology could be really useful, and making sure that, again, you have sort of that purpose behind why you're actually introducing the technology, and not just introducing technology to introduce technology into a clinical session or a therapeutic practice. I think that's something that I've learned personally, as far as recommending apps and making sure, again, that it's a good fit with your client. Because at the end of the day, you know what your client's needs are. They know what their needs are best, and your client best as far as what treatment needs they might have. And I see a couple of questions in the chat. One from Steve. Evidence. I hear the term evidence-based versus evidence-informed. Conversation around evidence-based and not allowing evidence-informed can hurt support for cultural communities. And yeah, I agree. That's a great question. And it's definitely a space where there could be more research done with those populations. And yeah, like Stephen had mentioned here as well, there definitely needs to be more work done to understand different communities and the diverse communities that are out there. I see a question from Deborah as well. Knowing it is important to always follow up on assigned homework. I do find it awkward at times to look at data on their phones. Any easy ways to handle this? Great question. I find that, like, if personally, and this is speaking from my experience, I find that if you have that agreement with the client that this is the purpose of this is to again have that clear goal in mind, and you have that therapeutic alliance with your client, and you're implementing this app or technology in a way that you both are on board, or at least on board to try it out. I feel like it's easier to bring up that conversation of reviewing that data with them, and again, reminding them of the purpose of what why you're going to be reviewing that data with them, and kind of being very upfront with that from the start. And I think that's something that has been something that I've practiced and I've found useful with the clients, at least that I've worked with, and integrated technology. And again, just having that sort of upfront disclosure of this is something that we're going to be working together with, and reviewing your entries together. And I find that it's I haven't had any pushback from the clients in that regard. But Stephen, I'm curious to hear what your thoughts are here as well.
I think one thing that is important to consider in terms of the use of these tools, especially when you're thinking about kind of like reviewing, data or information with clients, is, one is to think about the sort of physical space, at least if you're in a physical space and seeing someone in person that you're using to interact with the client. I think having, a desk that is at viewable level for both the client and yourself, so that you don't have to like hand over the phone necessarily, but it can be kind of set down at a place sort of mutually between the two of you. I think just similar to, what I would do if, not using digital treatment, just being aware of kind of like positioning and, asking for, if you do kind of, get closer to the client and kind of sitting maybe, I always like being catty corner on a desk. So if you're going to move over there and talk with them, kind of noting that, okay, I'm going to come over here and look at your phone now. Is that okay with you? And then making sure that you guys are kind of focusing on the same place. And I think that that's something that, sometimes we see in research, the sort of ways that therapists and clients sort of collaborate around data is, interesting and maybe not as intuitive as we think. And, people might make different interpretations of data. So I think like walking through with the client and having them explain a little bit like what they see in the data and what their perceptions are, and then understanding and trying to sort of pass that perception through your conceptual model and your lens of what you're working on with the client. So I think that's one aspect of, just trying to think about sort of the physical space and the way that you're kind of walking through that with the client. But I think just another sort of issue around, data I would just kind of bring up is that I think that there's sometimes the perception that data that comes from these devices is more objective and accurate. And I think that there's ways in which that could be true, but I think we also have to recognize that there's biases that go into any sort of, data collection process or data reporting process. These are often not, continually, passively unburdensome data collections. Even if they happen on the smartphone, it might make it easier, but there's still, challenges to getting that data. And so again, I think just accepting that we also have to sort of understand that this data may not entirely be objective or complete or completely representative of what our client's going through. And so really understanding their interpretation as well is important.
Thanks, Stephen. And I see another question here is actually a big one that we've gotten a few times is how do we navigate potential privacy concerns of some of these tools? So related to that, I know we've gotten questions before about any ethical and HIPAA compliance issues, things that might come up around the data use of these apps.
Well, I'll say with the data stuff, we do at One Mind PsyberGuide, we review apps based on their privacy policies and come up with a rating that rates them into sort of 3 levels: acceptable, unacceptable, or questionable. And, one of the things that we've noted after reviewing, lots of these applications on transparency around data security and privacy is that a lot of them actually don't even have privacy policies. And I think that, our general recommendation, and again, everyone can do what there's no one size fits all solution, and I want to really respect, client autonomy. But, our recommendation, especially as professionals, is that we would not recommend using a product that does not have a policy that kind of tells you what happens to your data when you enter it into a device. And I think that there are certain things, well, I should say, I think that there are certain things that we look at from a privacy policy point of views when we evaluate things from these in One Mind PsyberGuide, and you can learn more on our website. But one of the things that is kind of a key determination is, does data leave the phone or does data not leave the phone? And there are certain reasons why data leaving the phone could be really useful in clinical purposes. For example, it might have a clinician dashboard that allows them to access data outside of, sessions and things of the sort. But it also introduces a lot more questions. Where does the data go? How is the data secured? How is the data encrypted? And so in some instances, it might be just safer and easier to have an app that the data doesn't leave the device and is never transmitted. Clinically, then it brings up issues, as we kind of talked about, is how you kind of share and use that data. But that's one of those things where there's not a clear answer. It's not like one is better than the other, but certain clients and you as a professional, you might have preferences to kind of lean towards, something that does not share data and therefore doesn't have these other concerns that need to be thought about, encryption and HIPAA, and whether HIPAA applies and things of the sort, or whether you're open and your clients are open to having a technology that actually does transmit data. Yeah, and I saw in the chat, Colleen noted that the VA apps don't share any identifiable data with anyone. And yeah, that's true with those VA DoD apps. And I think that's one reason why they're a really great solution. I know I've talked to some colleagues at the VA and DoD, and it makes it a little bit frustrating sometimes from a research or evaluation point of view that they don't have that data, but they really do have a strong value in terms of security, and really sort of view that not sharing identifiable data with anyone is really important. And so, that is a place where I think if that's a strong concern for clients or for practitioners, sometimes it's just easier to use a product like that doesn't share information.
Awesome. And I think this is actually a good segue into our next question, which is what difficulties come with digital mental health versus normal mental health intervention? So that question around where the data goes and kind of having to add that extra layer of understanding where the data goes, I think is a big consideration here around what difficulties come with digital mental health. I think another one can be, at least something that I've experienced, is in sort of the rigidity sometimes of the intervention or some of the apps, and having to follow the apps, especially if they are sequential, like meaning you have to follow a certain sequence, especially around more of the psychoeducational components of the app. That's something that I found recommending these apps has been a bit of a challenge for me personally. Curious, Martha or Stephen, what maybe some of the difficulties that you've come across with some of these mental health interventions.
Yeah, I think privacy is a big one, is sort of noted, is that it definitely introduces some more complications around privacy. I think another one is like customizability and flexibility. This is another thing that came up in that study I mentioned earlier, where we were trying to develop a tool for cognitive behavioral therapy for depression. But one thing some of the therapists that I heard from some of the therapists is that, if you have a paper thought record, for example, it's very easy during a session to kind of mark that up and adapt it and, cross out a column or add a different word if it doesn't work for the client, or, mark it up in the session so the client better understands it and it's personalized and customized. And for some of these apps, that's a lot harder. Like some apps do have good customization features that you could, for example, change words or change frequencies of when like notifications are going. But other apps are actually kind of very inflexible, that you can't make a lot of changes. And that there's plus and minuses there. In some ways, it's great that you can ensure that these tools are being used with fidelity, and therefore backing up practices that support change. But on the flip side, flexibility might be hard to sort of adapt needs to specific clients or specific populations, or for the clientele or the types of folks that you typically work with. So I think that this lack of flexibility in some ways is can be seen as a challenge when in these digital mental health interventions, which is not the same in traditional sort of treatments that we deliver. So I think it's something that sort of two things. One is that, again, like piloting and using the apps ahead of time, so you know what some of those customization features are and you can adapt them in a session for a particular client. I think that's huge. So know the app and know what you can do to change it. And then I think number two is then if an app isn't adjustable and it's not consistent with the way that you do your practice or the way you would explain things to clients, maybe that's not the right tool for you to be using in your practice or with your clients. And so I think that just goes back to John's earlier point, and something we strongly believe through the work we do at One Mind PsyberGuide, which is that there is no one size fits all solution. There's not going to be one product or one tool that we can tell you all as professionals, or if you are consumers and looking to use these tools, there's no tool that I'm going to say like, here's the app for you and this is the one you should use. I think that it really takes a lot of contextualization and understanding, which is great because it's consistent with the way that we do treatment, but challenging because I know we want easy answers and we want those top 3 lists to be able to say like, these are the 3 tools you should be using.
Yeah, and just to add to Stephen's point, I think that in terms of choosing a mental health app, that sometimes there will kind of need to be a trade-off as to what you as a clinician value the most in the app that you're going to recommend. For example, we often see there can be sometimes a little bit of a disconnect between apps that have a really strong user experience and apps that have a strong evidence base. There is a small number of apps that are kind of fall within the overlap of that Venn diagram, but sometimes that can be a little disconnected. I think part of the reason for that is that at least traditionally, I think a lot of the apps that have a strong evidence base have been maybe developed in a more kind of research or academic context, which at least until recently maybe mightn't have had the kind of expertise or skill set to really bring that user experience up to a really high level. So as Stephen said, unfortunately there's no one app that is going to work for everything, and there are some apps but that have both a strong evidence base and user experience, but that's not always the case. So you may need to evaluate what you value most, also what's going to resonate with your client the most. As clinicians, I think obviously evidence base is so important. You want to be recommending something that's credible to your clients. But on the client side, if user experience is a really important factor for them, then that's something that needs to be valued too. If they're not going to use it long enough to reap the benefits, then user experience can be a really important factor. And just another kind of general difficulty to this question around digital mental health interventions, I do think we see challenges with sort of retention and engagement with these products. There's some research has shown that I think nearly a quarter of people actually just abandon an app after their first use of a health or mental health app. So retention can be a challenge, but I think that's probably where really integrating this into your practice and having this as an adjunct and really having other things in your practice that really support the use of this app and can help with the engagement and retention challenges, as opposed to someone just using this app entirely by themselves.
Yeah, and to piggyback off of what Martha and Stephen shared, I think some additional considerations, or not necessarily difficulties, but more considerations on the side of digital mental health versus normal mental health interventions, are things like actually making sure that the client meets the requirements, the technological requirements that are sometimes required of these apps. So like making sure they have the compatible devices, the internet or broadband access that's needed. And again, you would know that best as a clinician, and sort of understanding your client's situation. But also, again, with cost as well, with some of the interventions, I know there's an added cost with some of the more digital or technological interventions. I see a question from Steve around public studies that show de-identified aggregated data. And Stephen's answering that question in the chat, but in the interest of time, I do want to kind of push this forward a little bit. Definitely appreciate everyone's questions here, and appreciate the discussion we're having in the chat box, as well as questions that folks are bringing up. So again, in the interest of time, I'm going to skip ahead here. What populations are best served by digital mental health programs? I think this is more of a broad question, again, around which populations are best served by digital mental health programs. I can't say for sure, but I know working with kids and integrating digital mental health into practice, it's been kind of a mixed bag, to be honest. Like, it's hard to sort of, it could be challenging sometimes to convince or work with kids and ask them to maybe test out utilizing an app. But again, some of the, on the flip side, you do have that novelty piece, which I mentioned earlier, where if they've been through therapy before and have utilized tools in the past, having this in the digital format can be really exciting or useful to them. Curious, Stephen, around your thoughts around what populations are best served by digital mental health programs?
Yeah, well, I think I'd have a couple different answers to this question and slicing this a couple different ways. I mean, I think one is that unfortunately, despite research that shows that these tools can work in a variety of populations, I think that there's a dearth of good tools that have been developed for disparate populations that are available, are publicly available. So I think research has shown its work, and there's been good research products, but I think that the commercialization and the dissemination of tools for various populations is lagged well behind that. And we see that, One Mind PsyberGuide, for example, if you sort of filter tools by Spanish, then you don't see a lot of different products that are out there. And Spanish, I think, is the one that has the best coverage of different languages. So and I think we see similar things with, John, as you were noting, I think youth is a place where people are really interested to use these tools because, youth are digital natives and they're on their phones more often and they're technologically savvy and they're on social media and they often, they get they have email addresses after a certain age. But again, the number of products that are really well tailored and well designed for youth are really lacking. So I do think I'll say it's a limitation of this field. I think currently is that I don't know if English speaking Caucasian white populations are the ones that are best served, but they're probably the ones that there are the most programs and tools available that are really kind of designed and tailored for them, which is unfortunate. So I think that that's one sort of aspect of thinking about these tools. I mean, the other thing I'll note is that if we think about who might benefit most from these tools, that digital tools by themselves in a sort of self-help, unsupported way actually do provide sort of reliable but small benefits. And, especially among people with low to mild symptom severity, they actually are as effective as sort of guided or supported tools. And so I think from a continuum of care model, if we think about, trying to provide the most resources to people in need, there might be some people, especially those with low symptom severity, who might benefit from a digital tool as much as they would benefit from, traditional treatment. And I'd also like to note, though, I'm not suggesting, that these groups are the worried well. I think that there are people with lower symptom severity that's still impairing and still distressing to them, and I think would benefit from effective tools. And I think that digital tools could be one of them. So I think that's two ways to kind of think about what populations are best served. I think we need to do a lot more work developing good tools for disparate populations. And that's not currently what's present, but I think there's research that suggests that these tools could be helpful, which is why we need to really support commercialization, dissemination, development of tools for various populations. And then I think too, from a continuum of care model, I think that these tools have a very important role to play by themselves for individuals with low to mild symptoms, and sort of stepped care programs to better figure out like how we might be able to scale and use more limited resources for people who might benefit from them. But yeah, two ways I kind of think about how populations might be best served by these tools.
Awesome. Thank you, Stephen. And again, sorry folks for being a little bit crunched for time here, but I did feel like this was a really important question here as far as understanding what criteria clinicians use to recommend digital mental health solutions to patients. This relates back to kind of a lot of what we've been talking about as well. But again, I think it depends on really your client and really your understanding of your client, and finding what works best for them in the particular situation or need. And again, I think there's tons of tools out there, as we've mentioned before, tons of digital tools. And again, part of what the work that we do at One Mind PsyberGuide is to help filter that down and sort of help folks get a better understanding of what parts of these digital tools are really important to consider, and really which ones might be interesting for you in your particular case, or in your particular need. I do want to, I know, Deborah, I was typing out a chat and chat response to your question about an app for patients who have bipolar disorder. And I just wanted to note that I think it depends a little bit on which treatment modality you prescribe to, or what treatment you're working on with them. Personally, I've used a lot of mood tracking in the past with clients with bipolar. And then as well, depending on sort of the severity or need for safety planning, I know there are some apps out there that do provide that safety planning support as well. And I know we're kind of zooming through these last questions here, but real quick, what roles would a clinician need to look for if they want to contribute in this field? I want to ask Stephen this question. I know personally for me, it was working full-time as a associate marriage and family therapist. Transitioning to research was pretty exciting, and again, it's nice to kind of be in the field of digital mental health. It's something I'm passionate about, but curious, Stephen, for your thoughts about what roles clinicians would need to look for if they are hoping to transition to this field or contribute.
Yeah, I think there's a lot of different ways that clinicians can be involved, from doing research in this space to, actually joining a digital health company. I think that a lot of companies are really becoming aware that clinicians are of value to the work that they, surprise, surprise, it's useful to have people with expertise in mental health interventions who are developing a tool. But just, I think, given the way that some of these tools have been traditionally developed, I think that that's often been an afterthought, but I think that's really shifting. So I think that, if you are wanting to do this sort of full time, I think that there's a lot of opportunities in a lot of different companies. There's been a ton of investment in this space. Over $2 billion was invested in digital mental health tools in 2020 alone. So there's a lot of hiring going on. I think that also there might opportunities to consult if you don't want to do it full time, but kind of want to dip your toes in. So I think that some of it is like trying to figure out like, where do you see yourself vis-a-vis, and then I think like network, develop your LinkedIn page, join professional societies or communities of practice. And there's a lot of different organizations and group. Therapists in Tech is one that I know of that I think is a really good sort of networking opportunity that really kind of collects people who are interested in this space. But yeah, I think that there's a lot of different opportunities. And so I think having people to help you navigate those could be really useful.
Awesome. So I again, I know we're kind of closing in the last 3 minutes here. Just wanted to save some space for some calls to action for folks. I'm hoping you all can sign up for some future drop-ins at that URL listed here. So if you didn't get your question answered, or if maybe you have some follow-up questions, we do host these digital drop-ins twice a month. So every first and third Wednesdays of the month, we'll be hosting the digital drop-ins where you can stop by and get some answers around digital mental health. And I'll note again that we have some specific topics, but if folks have any topics that they're interested in, please feel free to reach out to me via email. And also, if you're interested in sharing your expertise or guest speaking at an event, please reach out to me via email as well. If you haven't already, please give our social media a follow. We regularly post news, updates, and call outs to thought leaders in the space on our socials, which are listed there. And once again, visit abct.org. So if you haven't already as well, you can give ABCT a follow on their socials, which are listed there as well. And finally, we wanted to call out the ABCT conference, which happens annually. This year, I believe it's in New Orleans. Yeah, New Orleans, in November 18th through the 21st. Again, it's a really great space to learn more about behavioral and cognitive therapies and really be a part of that community. And just for some closing thoughts, I just wanted to wrap up before we reach the 2 o'clock mark. I think there's a lot of potential in digital mental health to increase access to mental health care, especially given what we've gone through with COVID and sort of the upcoming or anticipated mental health wave, or the need for mental health in the upcoming years. So I think there's a lot of potential there for digital mental health to increase that access. And Stephen or Martha, I'm curious to hear your thoughts as well about any closing thoughts about digital mental health before we wrap up.
Yeah, well, I'll just say thanks. I just want to say thanks everyone for joining us who did. I thought this was a really great conversation that John and I had, and appreciate people adding some additional resources and your experiences in the chat. Sharing systematic reviews and updated versions of practice guidelines and things of the sort. So really our goal here again is to create community, and I really appreciate you're all joining into this community for this hour with us. And really just want to underline John's call that if you're interested in staying involved or getting more involved, we love to have guest speakers. We love to, have different opportunities to share content that people are interested in. Feel free to send us feedback or thoughts or ideas, or we'd love to hear from you. So really, I'd hope that some of the closing thoughts are your alls and not ours. So thanks for joining and appreciate your sharing.
Awesome. Yeah, thank you so much, everyone, for joining us. And again, thank you for wonderful discussion, and thank you for sharing everything that you shared in the chat. Hopefully we got some of your questions answered. I know there's a lot more out there. So hopefully you can join us for future drop-ins, and looking forward to seeing you all soon.
Thanks all.
Thanks, everyone.
Bye, everyone.